A normal ECG can feel like a huge relief. You see the clean lines, hear the reassuring words, and assume your heart is perfectly healthy. But the truth is more complex. While an electrocardiogram is a valuable tool, it does not always tell the whole story. Many people with a normal ECG may still be at risk for serious heart problems, and understanding why can be life-saving. An ECG records the electrical activity of the heart at a specific moment in time. It shows how fast the heart is beating, whether the rhythm is regular, and if there are obvious electrical abnormalities. This makes it excellent for detecting conditions such as arrhythmias, heart attacks in progress, or certain conduction problems. However, the heart is a dynamic organ, and many dangerous issues develop silently or appear only under specific conditions that a resting ECG cannot capture. One major limitation of a normal ECG is that it reflects only a snapshot, not a continuous story. If a person's heart rhythm becomes abnormal only during stress, exercise, or sleep, a standard ECG taken while lying calmly on an exam table may look completely normal. Conditions like intermittent arrhythmias can come and go, leaving no trace during a brief test. This is why some people with palpitations, dizziness, or fainting episodes still have normal ECG results. Another important factor is coronary artery disease. Blockages in the heart's arteries often develop gradually and may not affect the heart's electrical signals until the disease is advanced or a heart attack occurs. A person can have significant plaque buildup and still show a normal ECG at rest. Symptoms such as chest discomfort, shortness of breath, or fatigue may be the only warning signs long before any electrical changes appear. Structural heart problems can also hide behind a normal ECG. Issues involving the heart muscle or valves, such as early cardiomyopathy or mild valve disease, may not immediately disrupt electrical patterns. These conditions are better detected with imaging tests like echocardiograms or cardiac MRIs. Relying solely on an ECG can delay diagnosis if symptoms are subtle or ignored. Risk factors play a critical role even when test results look normal. High blood pressure, diabetes, smoking, obesity, high cholesterol, and a family history of heart disease all increase cardiovascular risk, regardless of ECG findings. A normal test does not erase the damage these factors can cause over time. In many cases, heart disease progresses quietly for years before showing obvious signs on basic tests. Inflammation and metabolic conditions further complicate the picture. Chronic inflammation, stress, and hormonal imbalances can strain the heart without immediately altering its electrical activity. Mental health also matters. Long-term anxiety and depression are linked to higher heart disease risk, even in people whose routine tests appear normal. The heart and mind are deeply connected. An emotional stress can trigger real physical consequences. Age and lifestyle choices also influence risk beyond what an ECG can reveal. Younger individuals may assume they are safe because their tests are normal. Yet poor diet, lack of exercise, and chronic stress can lay the groundwork for future heart problems. Conversely, older adults may have normal ECGs but still face increased risk simply due to age-related changes in blood vessels and heart tissue. This does not mean ECGs are useless. They are a powerful first-line tool and often the starting point for heart evaluation. The danger lies in assuming they are definitive. A normal ECG should be seen as one piece of a larger puzzle, not the final answer. Doctors consider symptoms, medical history, physical exams, and additional tests to form a complete picture of heart health. If you have ongoing symptoms such as chest pain, unexplained fatigue, breathlessness, dizziness, or fainting, it is important to speak up, even if your ECG is normal. Further testing may be necessary, including stress tests, Holter monitoring, blood tests, or imaging studies. Early investigation can prevent serious complications later. Ultimately, heart health is about patterns, not single moments. A normal ECG is reassuring, but it is not a guarantee. Paying attention to your body, managing risk factors, and maintaining regular medical follow-ups are essential steps in protecting your heart. Awareness, not complacency, is the key. Understanding that normal does not always mean risk-free empowers you to take control of your long-term cardiovascular health.